Heel spurs are a common foot condition that can cause discomfort and pain for many people. A heel spur is an extra bit of bone that grows on the bottom or back of your heel bone, which is called the calcaneus. It's like a little pointy extension that sticks out from the normal shape of the bone. These spurs can vary in size, from tiny bumps that are barely noticeable to larger protrusions that can be seen on x-rays. There are actually two main types of heel spurs: plantar heel spurs and posterior heel spurs. Plantar heel spurs form on the bottom of the heel bone, where it connects to the plantar fascia. The plantar fascia is a tough band of tissue that runs along the bottom of your foot, connecting your heel to your toes. It acts like a shock absorber and helps support the arch of your foot. When plantar heel spurs develop, they grow forward, pointing toward your toes. Posterior heel spurs, on the other hand, form at the back of the heel bone, where the Achilles tendon attaches. The Achilles tendon is that thick cord you can feel at the back of your ankle, connecting your calf muscles to your heel. Posterior heel spurs grow backward, almost like a little hook on the back of your heel. Causes of heel spurs. Heel spurs develop through a process called calcification. This occurs when calcium deposits build up on the heel bone over time. The formation of these spurs is the body's response to ongoing stress or strain on the ligaments and muscles of the foot. For plantar heel spurs, the process often begins with repeated strain on the plantar fascia. When this tough band of tissue is constantly pulled and stretched, it can start to separate slightly from its attachment point on the heel bone. This creates tiny tears in the membrane that covers the bone, called the periosteum. In response to this damage, the body tries to repair the area. It does this by sending in cells called osteoblasts, which are responsible for building new bone. These osteoblasts deposit calcium in the damaged area, gradually building up the bony protrusion we call a heel spur. This often happens in people who spend a lot of time on their feet, especially on hard surfaces. It's also more common in people who are overweight, as the extra weight puts more stress on the feet. The process is similar for posterior heel spurs, but in this case, it's the constant pulling of the Achilles tendon on its attachment point that triggers the calcification. The repeated stress causes micro tears in the periosteum, leading to the same healing response and calcium deposition. This type of heel spurs can happen from activities that involve a lot of running or jumping, or from wearing shoes that don't fit well and rub against the back of the heel. It's important to note here that this calcification process doesn't happen overnight. It typically takes months or even years of repeated stress for a noticeable heel spur to form. That's why heel spurs are more common in older adults who have had years of wear and tear on their feet. Other factors that can contribute to the development of heel spurs include age-certain foot shapes, like flat feet or high arches, and some medical conditions. For example, people with rheumatoid arthritis or gout may be more likely to develop heel spurs. Symptoms of heel spurs. The thing here is that not everyone with heel spurs experiences symptoms. In fact, many people have heel spurs without even knowing it. They might only discover them when they have an x-ray for another reason. However, for those who do have symptoms, they can range from mild discomfort to significant pain. For plantar heel spurs, the most common symptom is pain in the bottom of the heel, especially when taking your first steps in the morning or after sitting for a long time. This pain is often described as a sharp, stabbing sensation, like stepping on a tack. As you walk more, the pain might lessen, but it can return after long periods of standing or physical activity. For posterior heel spurs, the pain is typically felt at the back of the heel. It might hurt when you push off with your toes while walking, and the back of your heel might be tender to the touch. You might also notice swelling in this area. In both cases, the pain from heel spurs can range from a dull ache to a more intense, stabbing pain. It can make walking, running, or even just standing uncomfortable. Some people describe feeling like there's a pebble in their shoe, even when there isn't. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of heel spurs. Diagnosing heel spurs usually involves a combination of physical examination and imaging tests. When you visit a doctor or podiatrist with heel pain, they'll start by asking about your symptoms and medical history. They'll want to know when the pain started, what makes it better or worse, and what kind of activities you do. Next, they'll examine your foot. They might press on different areas to see where it hurts and check for any swelling or tenderness. They'll also look at how you walk to see if there are any obvious problems with your gait or foot mechanics. While heel spurs can sometimes be felt through the skin, especially if they're large, the only way to definitively diagnose them is through imaging. X-rays are the most common method. On an X-ray, a heel spur will show up as a bony projection extending from the heel bone. However, it's worth noting that finding a heel spur on an X-ray doesn't necessarily mean it's the source of your pain. Remember, many people have heel spurs without any symptoms. In some cases, other imaging tests might be used. For example, an MRI can provide a more detailed look at the soft tissues in your foot, which can be helpful if your doctor suspects other issues like plantar fasciitis or tendon problems. Treatment for heel spurs. The good news is that in many cases, heel spurs can be treated without surgery. The goal of treatment is usually to relieve pain and reduce inflammation, rather than to remove the spur itself. One of the first things your doctor might recommend is rest and ice. Staying off your feet as much as possible and applying ice to the affected area can help reduce pain and inflammation. You might be advised to wrap an ice pack in a towel and apply it to your heel for 15 to 20 minutes at a time, several times a day. Stretching exercises can also be very helpful, especially for plantar heel spurs. These exercises focus on stretching the plantar fascia and the calf muscles. A common stretch involves rolling your foot over a tennis ball or frozen water bottle. For posterior heel spurs, stretches that target the Achilles tendon can be beneficial. Your doctor might also recommend over-the-counter pain relievers like ibuprofen or naproxen. These medications can help reduce both pain and inflammation. In some cases, they might suggest a short course of oral steroids or a corticosteroid injection directly into the painful area. Proper footwear is crucial in managing heel spurs. Your doctor might recommend shoes with good arch support and cushioning. For some people, custom orthotics, which are special inserts for your shoes, can be very helpful. These are designed to distribute pressure more evenly across your foot and provide extra support where you need it. Physical therapy is another treatment option. A physical therapist can teach you specific exercises to stretch and strengthen the muscles in your feet and legs. They might also use techniques like ultrasound or massage to help reduce pain and promote healing. For posterior heel spurs, your doctor might recommend heel lifts or pads to reduce pressure on the back of the heel. In some cases, they might suggest wearing a splint at night to keep the plantar fascia stretched while you sleep. In most cases, these conservative treatments are enough to manage the pain from heel spurs. However, if pain persists despite these measures, your doctor might consider more aggressive treatments. Extracorporeal shockwave therapy is one option that's sometimes used for stubborn cases of heel pain. This treatment uses sound waves to stimulate healing in the affected area. It's usually done over a series of sessions and can be effective for some people, although it's not always covered by insurance. In rare cases where conservative treatments haven't helped after several months, surgery might be considered. The type of surgery depends on the location and size of the spur, as well as any associated conditions. For plantar heel spurs, a procedure called plantar fascia release might be done. This involves cutting part of the plantar fascia to relieve tension. For posterior heel spurs, the spur itself might be removed, or the Achilles tendon might be lengthened to reduce strain on the heel. It's important to note that surgery is generally seen as a last resort for heel spurs. The recovery can be lengthy, and there's always a risk of complications. Most doctors will exhaust all conservative treatment options before considering surgery. Remember, while heel spurs themselves are permanent bony growths, the pain associated with them is often manageable with proper treatment. Many people are able to return to their normal activities once they find the right combination of treatments. Now, we want to hear from you. Do you or someone you know have heel spurs? What treatments worked for you before? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.